Hello everyone. Now I'll present relationship between change of prostate volume and lower urinary tract symptoms after low-dose rate brachytherapy for prostate cancer. Lower urinary tract symptoms often occur following implantation of low-dose rate brachytherapy for localized prostate cancer. But the mechanisms and process of LUTS after LDRB have not been proved yet. We formed a hypothesis that the change of prostate volume after LDRB influences LUTS after LDRB. The aim of this study is to clarify the pathogenesis of LUTS after LDRB for establishment of adequate management for LUTS after LDRB. 84 prostate cancer patients who received LDRB were retrospectively enrolled in this study. PV, IPSS, IPSS-QoL, OAPSS, voided volume, maximum flow rate, and residual urine volume were evaluated at pre-implantation stage and 1, 3, 6, 9, and 12 months after implantation of LDRB. First, clinical parameters were compared with the baseline data. Second, correlation between change of PV and IPSS were evaluated. Finally, to assess the role of PV change after LDRB, the patients were separated into PV increase group and decrease group and compared parameters. PV 3 months after LDRB were used to separate the patients. This table shows all patient characteristics. 49 patients' Gleason score was 3+3, so a lot of patients were low-risk prostate cancer. 9 patients were received supplementary EBRT, and 14 patients were received combined hormonal therapy. These figures show change of PV and LUTS scores. PV decreased at 3 months after LDRB. LUTS scores increased at 3 months after LDRB and recovered in a process of a year. These show change of uroflowmetry parameters. All parameters were worse at 1 to 3 months after LDRB, but Qmax and residual urine volume tended to recover from 3 to 12 months. This figure shows correlation between change of PV and IPSS 3 months after LDRB. There was no significant correlation between them. This table shows comparison of patients' characteristics between PV increase group and decrease group. 34 patients' PV were increased and 50 patients were decreased. Compare the characteristics. Baseline PV of PV decrease group was significantly larger than PV increase group. This graph shows change rate of PV in respective groups. In PV increase group, the volume was increased at 1 month after LDRB and kept it till 12 months. In PV decrease group, the volume was decreased until 3 months and it tended to recover nearly baseline. These figures show comparison of IPSS and Qmax change between two groups. There was no significant differences between two groups. LUTS reached the peak 3 months after LDRB, synchronizing to decrease of PV. However, PV and LUTS after LDRB showed no significant correlation, and there is much individual difference of PV change after LDRB. Moreover, there are no statistical differences of LUTS parameters between PV increase group and decrease group. These results indicate that change of PV after LDRB does not associate with LUTS after LDRB. Concluding message: PV change might not associate with LUTS after LDRB. Other pathogenesis, such as direct neural irritation by irradiation, was indicated as the main cause of LUTS after LDRB. Thank you.